Hello everyone! I have exciting news to share. Since we last talked, I have completed the IBCLC Masterclass on oral habilitation for breastfeeding infants. And so that means that I am equipped with tons and tons of extra knowledge and exercises and all kinds of great stuff to help my clients whose babies might be dealing with an oral restriction like a tongue tie or lip tie and help them breastfeed better. Today I wanted to talk a little bit about tongue tie because I know it's a super, controversial topic, but it's one that has affected me personally. I have nursed my own babies with tongue ties. My third baby had a complete tongue tie all the way to the tip of his tongue, and it was excruciating nursing him. And I will link that video here so you can see how I dealt with that. It's not just a dedicated video on, nursing him, but it does talk about proper latch, good positioning, and how I managed to nurse him until we could get his tongue tie released. So I'll pop some pictures in here of my baby, his poor little receded chin before he got it released. When he was born, it was like he had no chin at all. It was like from the side he looked like a little turtle, with like a little beak. And while it's very, very cute, he just had no chin. He couldn't latch on because the jaw needs to be forward in order to have a good latch. So what is a tongue tie? How do you know if you have one? So for adults and older kids, you can do like this nifty little test, and really tongue ties are diagnosed by how functional you are and any symptoms you may or may not be having. So just because you might have some of this doesn't necessarily mean that you have a tongue tie or that it's something that needs to be addressed, unless it's something you want to look into more and kind of explore and discuss with a trained provider. So one thing you can do, adults and older kids, is suction your tongue to the roof of your mouth and then open your mouth as wide as you can. So you can see I do have a tongue tie, because you're supposed to be able to fit 3 fingers in between your teeth while you're doing that. Like I can maybe fit 2 fingers in between my teeth, and that it's very tight. And I had lots of orthodontic issues that thankfully my mother addressed when I was in elementary school. And so that kind of has taken care of itself. It's not taking care of itself. We took care of that. But then we didn't know anything about, tongue ties, especially posterior tongue ties. And I have played with the idea of getting mine released to see if that might help some of my jaw tension. When I get stressed out, I get tension all through my jaw and in my teeth. Like it just makes my teeth hurt all through the back of my neck and kind of up the back of my head. And I know that it's all connected. And, that tightness here is just, it gets so painful. So what about your baby? A lot of times, when you're a provider, your pediatrician, your OB actually says something about noticing that your baby has a tongue tie. And often they're saying it's a mild tongue tie and it probably doesn't need released. If they can see it with their naked eye without having to go in and lift the baby's tongue up to look in there, that's like a classic tongue tie. That's an anterior tongue tie. If they can just see it with their eyes, naked eyes, no oral exam, and they can just see it, then that's not a mild tongue tie. I don't think there's any such thing as a mild tongue tie. There's a normal stretchy frenulum underneath the tongue that exists because something has to anchor your tongue to the bottom of your mouth. But it's stretchy and allows your tongue to function properly. That's not a tongue tie. That's not a mild tongue tie. That's just how normal tongue is. A tongue tie is considered a tongue tie when it is restricting movement and it's affecting function. So the way babies remove milk from the breast is with a kind of wave-like motion of the tongue. It has to be really fluid, and the tongue has to be able to come all the way up to the palate, because that helps expand the palate, make it nice and wide so there's room for all the teeth. And that nice wide palate also prevents any kind of deviated septum from a very high palate coming up and messing with the airways. And it just allows room in the mouth and for the face to develop and the jaw to develop how it's supposed to, so that there is room for your tonsils and your adenoids in there. So when baby is nursing, that tongue is supposed to come up and kind of do that motion. And so that nipple is going to be pulled all the way back to the soft palate. So if you feel with your tongue on the roof of your mouth and move it back, you'll feel the end of the hard palate and the beginning of the soft palate. And that's where your nipple is supposed to hit while baby is nursing, which is why it should not hurt and it shouldn't cause your nipple to be misshapen or painful or anything like that, because your nipple is supposed to be touching that soft palate, not the hard palate that's bony, not the gum ridge that, when babies who have a tongue tie, they can't do that motion. So they go like this and they just chew. And usually they cannot get on that deep. So they're just chewing on your nipple. And it's incredibly painful. Take my word for this. Now, there are some babies who have a tongue tie that nursing goes fine for them. And it's not painful. And they gain weight because the parent has an abundant milk supply. And it may be that the only symptoms that you notice is that baby breaks suction while nursing. So you might hear that sound when they're nursing, that clicking, or even when they're bottle feeding. That's baby's tongue breaking suction, because that breast or that nipple isn't there sandwiched up against the soft palate, against the top of the mouth. That tongue can't get all the way up there, so there's space. Or the baby's tongue might be pulling back and breaking suction that way. So you might hear that clicking sound, and baby might be really gassy, because every time baby breaks suction, they're swallowing air. And so that leads to babies with giant man-sized farts, babies who are grumpy, who act like their belly hurts a lot, and they might be a mouth breather. They might sleep with their mouth open all the time. So you get this, that kind of almost Homer Simpson-like facial posture. And it can be really cute, and that baby snore can be really cute, but those are not normal things, and that's not healthy. My middle child has that mouth breathing, and he was my best nurser. I had no problems nursing him, just the clicking and the gas. And I mean, he was like colicky, which is another symptom. I didn't know that then, and now, because he is that mouth breather, he sleeps with his mouth open, that contributes to dental decay. We have to have procedures now, because despite all of our efforts with brushing, his teeth are getting cavities, and he can't breathe really well through his nose. He gets sick a lot, and he sleeps with his mouth open, so he tends to get sore throats because he's breathing through his mouth all night, and he's really, really restless. And these are all symptoms. These are all things that happen down the line when a baby's tongue tie is not released or taken care of in infancy. So and releasing it isn't like a quick fix. There's a lot of wound care that has to happen afterwards to assure that that wound doesn't close in on itself, doesn't heal back together really tight, or create scar tissue. And there's also a lot of body work that needs to happen in order to help baby learn how to use those different muscles, because the whole time they've been compensating with other things, like holding her really tight with their lips, so they might get all those nursing blisters around their lips, or be really, really tight around here, or squeezing in with their cheeks. And when baby's tongue is finally free to move, that gets really tired really fast, and they're still trying to use all these other compensations that they've been using since they were in utero. And it takes a while to learn how to nurse the right way. And so it's really important to have support if you are going this route. So look and find body workers near you, craniosacral therapists who specialize in babies who have had tongue ties or have tongue ties. Go see them before you even get baby, evaluated, or before you decide to release the tongue tie. Go and start working on those exercises, because the sooner you start, you're just setting baby up for success. It's like having physical therapy before you have a surgery, so that you're already strong before going into that surgery, so you're not working so hard afterward to try to regain strength. There's already a lot of it there. And those are some, that's my quick quick little talk on tongue ties. There's so much more. So much more. So I really love the book Tongue Tied by Richard Baxter. And it's how a tiny string under the tongue impacts nursing, speech, feeding, and more. So it's not only an issue with, breastfeeding or chest feeding, it's also an issue with bottle feeding, drinking from cups, eating solid foods. It affects a lot of things. And this is available on Audible, and it's an easy listen. So it's not super technical. It doesn't sound like you're listening to a textbook. This is appropriate for professionals and for parents. So, if you don't want to pick it up and sit down and read it, and I know who has time to do that when you have a baby or other kids or, a job, it can be hard to sit down and just read an actual book. So audiobooks are like a lifesaver. So this is on there if you want to learn more. There's also the Alabama Tongue Tie Center, I believe, has a website with tons of great information. And the Tongue Tied Babies Support Group on Facebook is another amazing resource. They can help connect you with your state Tongue Tied Babies group and even a Tongue Tied Adults group, so that you can connect and find providers near you who are trained, who've had this extra training to be able to be really skilled and know what they're talking about to help you and your baby. So I hope this was really helpful. If you want to see that video of how I nursed my tongue-tied baby, I will link that over here. And if this was helpful for you, please like and subscribe and share with your friends. Thanks very much.